Telehealth is used anytime you need advice or guidance from a doctor. Anytime you don't physically need a procedure, if your question is amenable to a conversation, then you can have that conversation through telehealth. And there are lots of different ways that you can communicate with a doctor without being in the same room.
It's the use of technology, virtual platforms such as FaceTime, Zoom, or other HIPAA compliant platforms to deliver medical care. I pretty much offer telehealth to all of my patients because I think it is a phenomenal way to really improve access to care for the patient. And it's a phenomenal way for the doctor to connect with the patient. So I think unless I need to physically examine them in the office or get an EKG or do something else that requires me to actually, make contact with the patient, telehealth is a great way to adjust medications. It's a great way to talk about chronic health problems. It's even a great way to talk about acute or new problems that may come up, because then on the telehealth platform, you can design a treatment plan and pursue that treatment plan and then follow it up with an in-person visit if you need to do.
Most people are able to do a really good job of describing to the doctor what they're experiencing. If someone says they're short of breath and we're talking about COVID-19, I want to know what would happen if you were to walk up a flight of stairs right now. And if somebody says, well, I just did, and I'm fine, then that's a vital sign for me. I'm able to understand how that person is doing, and we're able to decide if they need to go to the hospital or if they're able to stay home.
Looking at some of the data as well has shown us that using telehealth platforms for conditions like diabetes or coronary artery disease or atrial fibrillation or many of the other chronic conditions like congestive heart failure that physicians usually manage has actually improved outcomes and ability of patients to get to the target goals of medications much more efficiently.
If a person has a question and they just aren't sure where they need to go, is it appropriate to go to urgent care for this? Do I need to go to the emergency room? Then a doctor can weigh in very quickly through a telehealth encounter and help you know where the right place to go is. Many people don't know what they're going to get when they sign up or they register for a telehealth encounter. What you should expect is that you will be connected to and can ask a doctor questions, that the conversation can go back and forth. And at the end, hopefully, you wind up with your questions either answered or you understand what's needed next.
But really, as a patient, it's not all that different from the in-person visit. You get to see your provider, you get to talk to them, ask them questions. The only downside of the telehealth visit is really that inability for your provider to check your vital signs or for them to examine you. So that's where you have to become their eyes and ears. So you have to try to do a good job of recording your vitals at home. So get a scale, get a blood pressure cuff. Some people even get a pulse oximeter, which records your heart rate and your oxygen. And then make sure if there's something not right, like your legs are swelling up or you're getting a rash or something else that your provider may not be able to see on the virtual platform, that you bring it to their attention. You need to be empowered to request telehealth visits, particularly if you're in that high risk category when it comes to infection with COVID-19. So I offer all of my visits as telehealth visits as well. And the great thing is that because of the pandemic, the silver lining is that almost every major insurance plan is reimbursing telehealth visits just the same as they would an in-person visit. So if you have a question, you want to see your doctor, but you're a little afraid of going into the office, do not put off that question. Just call your doctor's office, request a telehealth appointment, and your insurance should cover it just the same as they would cover an in-person appointment.
CirrusMD is a chat-based telehealth platform. Our customers are largely employers. So many people have access to our doctors through their job as a benefit, but we also work with health insurance companies. And many people, when they look, they may find that they have access to CirrusMD and our doctors or doctors related with their health plan through our service that's already included with their package.